There are 7 indicators that your prostate may be enlarged. We'll examine the 8 distinct indications and symptoms that an enlarged prostate might cause in men in this video. If you have any medical problems, please consult your doctor. This video is intended exclusively for educational purposes. Benign prostatic hyperplasia, or BPH, is another name for prostate enlargement. More than half of men between the ages of 51 and 60 are affected. Over 70% of men in the 60 to 69 age range and over 80% of men over 70 years old make up this percentage. But it can begin at any age. The prostate is a little gland located beneath your bladder that resembles a walnut. If it gets bigger, it may begin to compress the urethra, the tube that runs from your bladder. This results in pain, leaking, urinating issues, and other issues. Why does aging cause the prostate to expand in men? The body experiences hormonal fluctuations that might trigger the proliferation of prostate cells. Men, for instance, typically have greater insulin levels as they become older. We refer to this as hyperinsulinemia. One hormone that can stimulate cell growth and multiplication is insulin. Elevated insulin levels are associated with metabolic syndrome and elevated blood sugar, or cholesterol levels, both of which are prevalent in middle-aged males. As testosterone transforms into estrogen, it also tends to decrease in males as they get older. Another hormone connected to PE issues and prostate enlargement is estrogen. These hormone abnormalities can be brought on by alcohol consumption, liver damage, being overweight, or consuming an excessive amount of junk food. The prostate may also be impacted by these. How to shrink the prostate. If you have an enlarged prostate, you may be wondering how to stop it from expanding further and help it shrink back to normal size at home. Now let's examine this. 1. Make use of pumpkin seeds. Every day, consume a tiny handful of pumpkin seeds. They contain magnesium, zinc, phytosterols, and vitamin E. Together, these enhance cell function and balance hormones to shrink the prostate. 2. Consume veggies with crucifixes. Include organic cruciferous vegetables in your daily salad, such as radishes, broccoli, arugula, kale, collards, or cabbage. These contain nutrients that support your liver's production of more antioxidants and removal of excess hormones. These aid in the prostate's healing and protection. 3. Absence of sugar and alcohol. Take alcohol and sweets out of your diet right away. Alcohol enlarges the prostate by raising estrogen levels and damaging liver cells. In the same way, sugar increases insulin, which causes the prostate to develop. Reducing your intake of sugary foods will help your symptoms go better quickly. 4. No dairy. Eliminate all dairy products right away. Growing cows are given growth hormones in milk and dairy products. These hormones cause men with enlarged prostates to become extremely sensitive, which can cause the prostate to grow larger. Eliminate all forms of dairy, cheese, yogurt, etc., and observe a prompt improvement in symptoms. 5. Sporadic rapid. You probably have a fatty liver if you often consume alcohol or are overweight in the abdomen. Inflammation and hormone changes result from this. Adhere to a plan of intermittent fasting. If so, consume all calories within a 4-hour window and fast for the remaining 20 hours, 2 or 3 days a week. One of the most effective and inexpensive ways to reduce the size of the prostate and cleanse the fatty liver is to fast. 6. HIIT, or high-intensity interval training. Men who do high VT for 10 minutes twice a week will noticeably increase their testosterone levels. This aids in the reduction of insulin, DHT, and estrogen. Exercise also aids in burning blood sugar excesses, which lowers insulin levels and causes inflammation in the prostate. 7. Consume dietary supplements. Make use of particular vitamins and supplements, such as EGCG, phytosterols, and zinc bisglycinate that are targeted at the prostate. Final words. Hormone accumulation, such as that generated by insulin and estrogen, is the cause of prostate growth. You can change your diet if you can recognize the urine symptoms of an enlarged prostate from today's video. This stops the growth from continuing. Prostate shrinkage and prevention of enlargement can be achieved by cutting out junk food and alcohol, increasing physical activity, taking supplements, and consuming cruciferous vegetables. It lowers the chance of prostate cancer as well.